The topic today is lower back pain. And here to teach us a little bit more about minimally invasive surgical procedures is Dr. Roderick Claybrooks. He is an orthopedic spine surgeon with offices in Dearborn and Novi. Welcome to the program, Dr. Claybrooks.
Thank you.
Doctor, when a patient comes in to see you, how do you determine the best surgical procedure for that patient?
Well, it's usually based on symptoms, and it's also based on how severe. Now, with the techniques, the way they've been advanced compared to things that we were maybe doing 20 or 30 years ago, many things that we used to treat in the past can be done through what we call minimally invasive or much smaller incisions. It's less blood loss, less trauma to the patient, and usually it's based on the location of the symptoms and the severity of the symptoms.
When we talk about minimally invasive and we're talking about back,
Yes.
that must be a really good thing, because who wants to have their spine all opened up?
Yes, and that's how we used to have to do the majority of the surgeries. Very, very large incisions, lots of blood loss, longer hospital stays, and obviously much longer recoveries. Now we can do surgeries minimally invasive through sometimes 20 or 20 millimeter incisions, much shorter operating room times, that's less anesthesia, and the recovery period has been shortened significantly, so patients are able to get back to their normal routine much faster.
Oh, that's wonderful.
Yeah.
Now, you said 20 millimeter. How many inches is that?
It's about 1 inch, so the incisions are very, very small.
Very small.
And because the incisions are so small, we're able to keep the blood loss to a minimum, and the patient can have a much faster recovery because the incisions are so small.
Let's talk about some of those minimally invasive surgical procedures.
Yes.
I know a few of the terms, and I bet you know a whole lot more. What is a laminectomy?
A laminectomy is when we remove the bone that may be causing pressure on the nerves in the lower part of the spine. Over time, we develop arthritis and bone spurs, and as those bone spurs start to grow, they can put pressure on the nerves. It can cause patients to have pain in the legs, numbness in the legs, weakness in the legs. A laminectomy is when we go in and we trim that bone away to take the pressure off the nerves so that the legs will feel better and the patient can walk farther.
But we've learned that that spine is so important for protecting
Yes.
the nerves in there, so you don't take so much bone off that it's not protected anymore.
That's correct. We do take enough away so that the nerves have enough room to move, but we still leave a lot of the structures remaining. But there are times when there's so much pressure on the nerves that we have to move even more bone away. That may cause the spine to become unstable, and that may be a situation where we may have to do what's called a spinal fusion, where we may have to place implants inside the spine to regain the stability that may have been lost.
And then what's a discectomy?
A discectomy is when we trim off the disc material. If you've ever heard of people say they have a pinched nerve, sometimes that comes from a herniated disc. Think about a herniated disc like you would think of a jelly donut. You have a soft center that may erupt from the inside. When it erupts, it puts pressure on the nerve that also can cause pain in the leg, weakness in the leg. As opposed to doing a laminectomy where you remove lots of bone, you just trim off a little piece of the disc that takes pressure off the nerve so that the leg will feel better.
Now, I've also heard that term slipped disc.
Yes.
Is that the same thing?
You know, a lot of the terms are interchangeable. That may mean the herniated disc, but sometimes it may mean something that we call a spondylolisthesis, meaning that one of the vertebrae are actually slipping out of place, as opposed to the bones being lined up perfectly like blocks one on top of the other. Sometimes over time that they will actually start to slip out of place like a house leaning, and we have to regain stability sometimes with a spinal fusion.
Now, we've talked about spinal fusion, discectomies, laminectomies. These are minimally invasive techniques that you use as an orthopedic spine surgeon.
Yes.
Are there other techniques?
Well, there's plenty of other techniques. Sometimes we do a procedure called a kyphoplasty. As we get older, sometimes our bones can become softer, and when they become softer, they get weaker, and in turn, they can crack, and sometimes they can fracture. And nowadays, we treat that with a procedure called a kyphoplasty, where we actually inject liquid cement inside the bone. It fills the cracks of the bone, and it takes the pain away. It's a very simple procedure. It takes about 10 or 15 minutes.
Wow. Now, I've heard people talk about they have brittle bones.
Yes.
Is that the kind of thing where
That
this
is.
procedure might work?
Yes, that's the brittle bones, that's the osteoporosis, and unfortunately, you know, if you live in climates where you don't get a lot of sunlight, or if you don't take in a lot of vitamin D, you may be suffering from osteoporosis, or if you've undergone premature menopause, or many other reasons that your hormones may be out of balance, you may be experiencing osteoporosis, which can make the bones brittle, and in turn can cause them to fracture.
Now, we've been talking about minimally invasive techniques, and
Yes.
you said earlier that one of the upsides to that kind of surgery is a fast recovery. But let's talk about recovery times with back surgery, and how grueling is the recovery? Do you need to do physical therapy for things?
It depends on which procedure you have. So, for example, if you do a discectomy, which is when we just trim off a portion of the disc, it takes pressure off the nerve. The recovery for that may be 3 weeks or so. If you end up doing a laminectomy, which is more extensive, you remove a lot of bone, sometimes that may push the recovery back by another week or so. If you end up doing something like a spinal fusion, recovery for something like that may be a couple of months. So it really depends on how extensive the procedure, how extensive the patient's symptoms were to determine how long the recovery is.
So if someone is watching this show who is experiencing a lot of lower back pain, and now they realize, depending on what you do, it could be a lengthy recovery. What message of encouragement do you have for our viewers who've been putting it off, because you're the last person they want to see. They don't want surgery.
That's true. I tell people that a consultation is painless. It's not a commitment. And so although people are very apprehensive and they have a lot of doubts sometimes about spine surgery, it doesn't hurt to at least just get checked out, because there are times when we see patients that may have waited a little bit too long, and although they still may be surgical candidates, they would have had a much better outcome had they gone and seen a doctor a year ago, 6 months ago, et cetera. So there's no commitment in just having a consultation, having the doctor look at your x-rays, your MRIs, your CAT scans, doing a very quick neurological examination to see what your diagnosis is, and to also sit down and talk about what types of options may be available, because more than 90% of people with neck or back pain will never need surgery. So most people who have these problems are not surgical candidates, but it's still good to get checked out.
That is a really excellent point. Get the consultation.
Yes.
Learn what your options are,
Yes.
if you have options. No,
Yes.
no harm in that.
Yes.
Now, you've talked earlier about the tremendous advances in spine surgery over the years. What do you see on the horizon?
It's a category we call biologics, which is, in the past when we did things like spinal fusions and we needed to get a lot of extra bone to help with the healing, you may have heard people say, I had the doctor take bone from my hip. That's what we call a hip graft. Where we'll go to other parts of the body, retrieve bone, use it in the spine to enhance the healing. Well, that would be a second incision, a second surgery, and a longer recovery, because you basically had 2 surgeries at the same time. Well, with the technology advances, we're trying to do things called biologics, meaning get these things off the shelf, open a box, add proteins, other synthetic materials, so that a patient may not have to have a separate incision and a separate surgery and still get a very good outcome.
Well, good to know. There's some great breakthroughs now, and even more on the horizon.
Yes.
So people should come and see you.
Yes.
Thank you so much for being with us today and teaching us even more about how we can alleviate lower back pain.
Thank you for having me.
In addition to thanking Dr. Roderick Claybrooks, I want to thank Dr. Parmod Mukhi, Dr. Tejpal Panu, Dr. John Cohen, and all the staff at the Oakwood Pain Management Clinic at Heritage Hospital. Thank you so much for tuning in today. And for more information on lower back pain and the physicians you've met today, go to oakwood.org or give us a call at 1-800-543-WELL. Thank you so much for tuning in, and we'll see you next time.